Hello everyone and welcome back to our channel. My name is Sogol and I am an associate marriage and family therapist here at Embracing You Therapy. Today we are delving into a topic that affects many of us deeply: rejection. Nobody enjoys feeling rejected, whether it's a minor setback or a crushing blow. The emotions that come with rejection, such as sadness, embarrassment, or even frustration, are universally felt. But for some, like those with ADHD, there is another layer to this experience, which we call it rejection sensitive dysphoria or RSDD. RSDD is closely linked to ADHD, causing intense emotional reactions to perceived rejection or criticism. RSD can make everyday interactions feel like emotional landmines, leaving individuals overwhelmed with feeling of sadness, anxiety, or anger. This can lead to avoidance behaviors as a means of self-protection. Understanding RSD is crucial for those with ADHD, as well as their loved ones or even their therapists, to help them to develop effective management strategies to improve their quality of life. So let's dive deeper into what RSDD looks like and how it impacts individuals with ADHD. RSDD in ADHD is an extreme emotional sensitivity triggered by the belief of being rejected or criticized, often leading to intense mood swings and even suicidal ideations. Those with RSDD and ADHD typically cope in the following ways. They either become people pleasers to ensure others are not displeased with them, or they stop trying altogether and avoid any anxiety-inducing activities to avoid disappointing others. But living with ADHD and RSDD isn't just emotionally demanding. It can lead to several complications, such as, number one, putting up emotional walls. RSDD ADHD can make it hard to open up to others as they may not understand how intense and deep the feelings of distress are. Number two, extreme fear. The fear of rejection can manifest into fear for your life as your brain goes into panic mode. This is a nervous system response that can strike in an instant, making it difficult to regulate. Number three, difficulty receiving feedback. Negative feedback from loved ones may feel like you are being rejected by them, which is highly triggering for those with RSDD ADHD. No matter how minor their comment is or how gently they address the issue, you may feel extremely hurt by their words. And number four, misunderstanding situations. Misunderstanding others' words or actions often lead to intense feelings of crippling anxiety and self-blaming, although that may not be true. So how can one manage ADHD and RSDD effectively? Here are three strategies. Number one, cognitive behavioral therapy, CBT, which is a type of therapy that helps people recognize and change negative ways of thinking that cause strong emotions when faced with rejection or criticism. CBT is focused on setting goals and changing thought patterns to improve how you feel about yourself. Negative thoughts about yourself, how you talk to yourself, and how you react to situations can all be impacted by low self-worth. But the good news is that CBT helps change these negative thoughts, and it helps you to rewrite the internal story of yours. In summary, CBT teaches you how to identify, address, and adjust your actions through diligent affirmations, scheduled routines, and a willingness to revisit your patterns and adapt your toolkits as you go. The second method to manage ADHD and RSDD is through practicing mindfulness meditation. This approach can help individuals with ADHD or RSDD to regulate their emotions, reduce stress and anxiety, and increase their overall well-being. Mindfulness meditation can be practiced daily and help individuals develop greater emotional control. During meditation, you learn to observe and acknowledge your thoughts without criticizing them. If a thought comes up while you are meditating, you acknowledge its presence, accept it, and let it go. By concentrating on your breath, visualization, or sounds, you stay calm while staying mindful of your emotions. If your mind wanders to the past or future, you bring yourself back to the present by focusing on your senses. What do you feel, smell, taste, hear, see? These sensations help you stay grounded and stay in the current moment. The final method for managing ADHD and RSD involves the use of medication. Medication can be an effective treatment for managing ADHD and RSD, particularly in more severe cases. Stimulant medication like Adderall or Ritalin are commonly prescribed to help individuals with ADHD improving focus and emotional regulation. However, it is crucial for medication to be prescribed and overseen by a healthcare professional. While medication is a great boost, it works best in conjunction with therapeutic treatment and, like we mentioned, mindfulness techniques. Therefore, you and your doctor may need to revisit your prescription over time, and your therapist might have tactics to guide you in deciding what is working best for you. It's also essential to remember that managing ADHD and RSD is an ongoing process that requires patience and self-compassion. Building a support network of friends, family, and professionals can provide invaluable support along the way. In conclusion, while dealing with ADHD and RSD presents challenges, overcoming them is entirely possible. With the right tools and support, individuals can learn to navigate their emotions more effectively and lead fulfilling lives. Remember to prioritize self-care, be patient with yourself, and never hesitate to reach out for help when needed. Thank you for joining us today. If you enjoyed this video and found it helpful, make sure to show your support by liking, sharing, and subscribing to our channel. Wishing you all the best until we meet again.